Sometimes we do need to prescribe medicines for people with borderline personality disorder, um, especially when they have other coexisting conditions. The most commonest is depression. When people have very severe depressions, which doesn't usually come around with the talk therapies. So most of the times, talk therapies themselves might be enough for treatment of this co-occurring depressions too. But there will be times where that may not happen. In those situations, medicines could be used and maybe should be used. That's in a small number of patients. Now, those are the antidepressant medicines. The other situations are, so if people are developing, we have developed as psychosis, and if those psychoses are lasting for longer than they should, because often brief psychosis can occur for a few minutes or for about half an hour, 1 hour, which are usually in response to severe stress. That might be all right, but they might be able to overcome that with talk therapies. But there may be situations where the psychosis is lasting for a longer period of time. There they need medicines, such as antipsychotic medications. Or in some situations, they could have a bipolar disorder. In addition to borderline personality disorder, then they need mood stabilizers, and so on and so forth. So just because someone has a borderline personality disorder, doesn't mean that they can't have other psychiatric disorders. In fact, the default is that usually they do have other psychiatric disorders. And for those psychiatric disorders, we may have to prescribe medications. When it comes to ECT, though, ECT, the electroconvulsive therapy, we don't have any evidence to say that electroconvulsive therapies are going to help people with borderline personality disorder. In fact, we know that even depressions that co-occur with people with borderline personality disorder doesn't respond well with electroconvulsive therapy. So electroconvulsive therapy should be reserved for people with very, very severe depressions with borderline personality disorder, and those depressions that doesn't respond to medicines and they're not responding to psychological treatments, then ECT might be an option. That's only in a very small percentage of people. The other treatment, which is the emerging new treatment, is TMS, transcranial magnetic stimulation, which is a very interesting treatment. Now, there is not much research in people with borderline personality disorder yet. The research that we have currently are few, and some of them are supportive, some of them are not supportive, so we're not sure. So I wouldn't rule out transcranial magnetic stimulation as a possible treatment option, but I don't prescribe it right now because we still don't have enough evidence.